Good afternoon, everyone. This is Edward Halperin, the Chancellor of the College, and welcome to our town hall. We've been in the habit of having these town halls since I came as Chancellor in 2012, usually in the auditorium in the medical education building, and we do it 2 to 3 times a year. But since the onset of the pandemic, we've switched over to using this Zoom webinar format. We have aspirations, as the story of the pandemic continues to play out, that soon we'll be able to go back to doing these town halls in person, but until then, this format will suffice. We have a great deal to talk with you about this afternoon, and a large number of your colleagues are joining us as speakers. If you have a question or comment about what you hear in the presentations this afternoon, use the question and answer link on the bottom of your screen. On most computers, it's either on the bottom right or sometimes might be on the top. It'll say Q&A. Type your question or comment in and send it, and then we'll be monitoring them, and we'll get to as many of them as possible in the time we have. We, of course, as a campus community, received some sad news yesterday, learning of the passing of the wife of Professor Edward Messina. We extend our condolences to Professor Messina and to the family on Mrs. Messina's passing. May her memory be for all a blessing. Well, let's get started with our presentations. And once more, a reminder, if you have a question or a comment, go ahead and use the Q&A function on your computer screen. And otherwise, I'll see you after the presentations are over to moderate the Q&A part of our town hall meeting.
Good afternoon. I'm Marissa Montecalvo. I'm the Medical Director of Health Services, and I'm speaking today on student COVID-19 vaccines and the vaccination policy. So the policy was posted on June 11th, and any student accessing campus over the upcoming academic year is to submit proof of completed vaccination, proof of a first dose of vaccine, or a completed application for medical or religious exemption, with the deadlines of July 1st for current students and August 1st for incoming students. Proof of vaccination is a completed COVID-19 vaccination record. So not one that looks like this, but a completed one with name, date of birth, manufacturer, lot number, and dates of vaccination. If you don't have this, a document signed by a licensed practitioner with the same information is required. If you still need vaccine is readily available throughout Westchester County and New York. At the Department of Health in White Plains, we have a walk-in clinic every Friday. Right here on the grounds of the medical center, you can receive vaccine by appointment. There, the hours vary and you need an appointment. And you can always go to the New York State Department of Health website and look for vaccine anywhere in New York. It is readily available. I'm showing you this slide from CDC because this is what is used to look at for when you can proceed readily with vaccination, when there could be a precaution, and when there's a contraindication. And so I just want to be clear that the contraindications to vaccine are very few. It is really an anaphylactic or severe allergic reaction to the vaccine previously, or to a known component of the vaccine for the first time. And that is usually with the messenger RNA vaccine, you're looking at reactions to polyethylene glycol. And in such situations, one can receive the Janssen vaccine. So there are really very few contraindications to vaccination. If you are concerned about a clinical consideration for yourself, I would refer you to the CDC website, which is excellent. and covers many of the considerations in respect to vaccine. So why do we have a student vaccination policy? Well, we're in the training and education business, and the data strongly support vaccination, very, very strongly, for us to move toward a fully vaccinated community. So I'm just going to show you this briefly. These are the phase 3 data that led to the emergency use approval for the vaccines. The Pfizer and Moderna vaccines, you're looking at protection from symptomatic disease, extraordinarily high numbers. Janssen should not be directly compared to these because the trial was done differently. The endpoints were different, and these trials were done in areas where there were many more variants present that could get around the vaccine. But nevertheless, you still have very good protection from moderate or severe disease, which in the end is what you care about. And there's much more data. After those phase 3 trials, the published data from Israel with over 500,000 people in it, the efficacy of the Pfizer vaccine was still 94%. For pregnancy, there's a preliminary analysis in the New England Journal of Medicine showing that there did not appear to be a safety issue. And in adolescents, 12 to 15 years of age, the vaccine appears to be highly efficacious with a very robust immune response. And that's in this week's New England Journal. Is it all perfect? Nothing is perfect. With the millions of people that have been vaccinated, of course, there are going to be some adverse events. You're aware of the issues of thrombosis with the vector vaccines and some cases of myocarditis, but these numbers are very, very few relative to the numbers of protection and the efficacy, and thus these vaccines are very strongly recommended by the American College of Immunization Practices. If you were vaccinated outside the United States, WHO approved vaccines. If you've completed the vaccine series, meet the requirements for our vaccination policy. If you did not complete the vaccine series of a WHO approved vaccine, then it is recommended that you receive an FDA approved vaccine in the United States. What about the exemption process? So we do have a process. The application is with the policy. You can apply for either medical or religious exemption. Medical exemption needs support from a licensed physician or advanced practitioner. Religious exemption is a completed statement from the applicant. Exemption requests are reviewed by a committee. And in these requests, when these requests are reviewed, it is de-identified. The people hearing about the request do not know who is applying, and then decision letters are sent out by health services. What happens if you're granted an exemption? Well, for sure, those who are not vaccinated will be required to wear a mask at all times indoors, even if that changes in the future, which it is likely to for the vaccinated individuals. There will be a requirement to maintain some social distancing to the best that can be done, because there still is the possibility of transmission, even with wearing a face mask, if you develop disease. Travel outside of the tri-state area will require testing and self-quarantine in accordance with our travel policy. There may be a testing requirement instituted, and of course, dependent upon the incidence of the infection, more stringent measures may be put into place. And right now it's summer, the incidence of infection is low, but it is not zero in Westchester County. There are children in camps getting this infection, and we are still seeing some transmission. It is very, very likely that this will increase in the late fall. This appears to be a winter disease. And so the issues of vaccination will be extraordinarily important at that time. And we are trying to have everyone prepared for that in advance. Thanks so much, and I look forward to your questions.
Hello, and thank you for the opportunity to introduce myself. My name is Robert Lancia. I've been hired by the college to replace Bill Allison, who was our former director of security. Thank you for the opportunity to talk about security, something I'm very passionate about. And it's something I immediately renamed when they hired me. We've gone from campus security to public safety. Many of you have asked me why the name change. Why did I feel it was necessary? I believe the name public safety is far more inclusive of what our officers do and what we provide to the campus. They're trained in a variety of safety measures, investigative measures. They don't only sit on fixed posts, but they're out there every single day on motor patrol. They're also your shuttle driver, and at times they're a de facto maintenance worker. So I feel that public safety is far more inclusive of just calling ourselves campus security. And as public safety, our goal is to create a safe environment for our staff and students. As you know, we have some interesting neighbors around campus, and I think improving our public safety will improve our image to our prospective students and our present students, despite some of our neighbors. The name change alone, of course, is not going to change what you see when you drive on campus or drive near our campus. It's not going to change some of our neighbors. But we are going to be making some other changes, some physical changes to the uniforms, the way our vehicles look, the way the officers conduct themselves. I have a big focus on them. This school is creating future medical professionals and dental professionals. My ask of our officers is that they act like professionals, act like they're working in a medical office or in a medical field, and provide excellent customer service. These are some of the changes that I believe are going to add value to our campus. All of us, staff, students, public safety included, we are all here to educate future medical and dental professionals. Our entire environment should assist the college to that end. I grew up with an expression, how we do the little things is how we do everything. And in medical college, I think public safety is probably one of our little things. I'm going to make sure we do this little thing right. And hopefully I'll be able to do that with some input from staff and students. We'll be starting a safety council soon, where I'll try and get a group of us together, probably quarterly, discuss some safety issues and make things better on campus. We have a beautiful campus. It's very safe. I think our public safety officers do a good job, and I think we can do a better job. And that is why I was hired here, and that's what my goal is. Thank you for your time, and stay safe.
Good afternoon. I hope everyone is having some enjoyable time this summer. I want to first thank all of our faculty, staff, and administrative leaders of the School of Medicine for helping our learners have such a successful year despite the challenges of the COVID pandemic. Congratulations to our students and residents on moving forward in their careers. And this is a very exciting time here at New York Medical College, where we welcome all of our new entering students. I also want to acknowledge the many research advances that our faculty and learners have made during this past year. Now, as most of you know, we have successfully integrated pathology, microbiology, and immunology into one department. And Dr. Humayun Islam is the chair of that department, and the integration has gone very well, and it's been very successful. We are now recruiting a vice chair of research, a major position for the school, to help lead that department's research. And I look forward to helping with this important faculty addition to our faculty. The lead candidates have been identified, and they will soon be visiting the campus. And I appreciate everyone's opportunity to interact with these candidates and provide feedback. I am also excited to announce that we've successfully recruited 2 new chairs for major departments here at New York Medical College. I want to thank all of the search committees and the lead people who have helped in this very important recruitment. Now, for radiation oncology, I wanted to announce that Dr. Mark Hurwitz officially started this month as the chair of that department, as well as director of radiation medicine at Westchester Medical Center. Now, Dr. Horowitz is a widely known expert in the area of genitourinary oncology and thermal medicine. He comes to New York Medical College from the Sidney Kimmel Medical College at Jefferson University in Philadelphia, where he was the Quality and Safety Officer for the Cancer Center and Professor and Vice Chair for Quality, Safety, and Performance Excellence in the Department of Radiation Oncology. He was also Director of Thermal Medicine and the Medicine Residency Program Director for that department. If you want to read more about Dr. Hurwitz, the latest Dean's newsletter has a nice article about Dr. Horowitz and additional information, but please welcome Dr. Horowitz. He's already on campus. Dr. Horowitz will advance our mission in this very important area of radiation medicine and education research and service to our patients. I would be remiss if I didn't thank Dr. Murthy for his many years as serving as chair of this department and director. And Dr. Murthy will be staying on as a faculty member and helping in the transition. Thank you, Dr. Murthy. I'm also excited to announce that Dr. Tracy Milligan will be joining us later this summer as the new chair of neurology and director of neurologic services at Westchester Medical Center. So Dr. Horowitz is currently associate professor at Harvard Medical School and is a real expert in the area of epilepsy. She also is vice chair of education in the Department of Neurology at the Brigham and Women's Hospital, and she is a major expert in the area of neuroscience education, leadership, and volunteerism. She did receive the highest award for service, institutional service at Harvard Medical School, which is known as the Barbara McNeil Faculty Award for Exceptional Institutional Service. And she also serves as the Vice Chair of Education and has led many volunteerism efforts. Please join me in welcoming Dr. Milligan as she joins our campus in August. Dr. Milligan, in addition to her expertise in accelerating areas of neurologic treatment for disease, will be enhancing our neuroscience education for our medical students and our residents. Again, I want to thank our current chair, Dr. Singh, for his many years of service as chair of the department and director of this service at Westchester Medical Center. Dr. Singh has been very instrumental in helping in this transition as well. So it's an exciting time here at New York Medical College. I look forward to an exciting new year, and I'm honored to serve as your dean at New York Medical College School of Medicine. Thank you very much.
Hello, thank you for joining us today. My name is Dr. Dana Mordew. I'm a faculty member in the Department of Pathology, Microbiology, and Immunology, and the Vice Chancellor for Middle States Accreditation. And I want to give everyone an update of where we stand in terms of the work that we've put into reaffirmation of accreditation with the Middle States Commission on Higher Education, or MSCHE, or Middle States. So reaccreditation or reaffirmation of accreditation with Middle States occurs now every 8 years. It used to be every 10 years, and they've recently changed this. And as most of you know, there are 3 parts to this. One is a college-wide self-study and its submission to Middle States. There's an evaluative site visit by a Middle States accreditation team. And then there's a commission vote on reaffirmation of accreditation. So New York Medical College has been in the midst of its self-study process for just over 2 years. And we submitted a 115-page document to Middle States in February 2021 for their evaluation and for the evaluation of the Middle States team visitors. And we had multiple goals for the New York Medical College self-study. One, of course, was reaffirmation of Middle States accreditation of the college. But we also wanted to engage in an inclusive, open, and evidence-based self-appraisal process, one that would purposely involve stakeholders across the New York Medical College community. We also wanted to integrate strategic planning in the Middle States self-study to identify specific opportunities, challenges, and recommendations. And importantly, we wanted to take what we found in the Middle States self-study and take those recommendations that we discovered for improvement and put them into the New York Medical College strategic plan to ensure that they would be acted upon. In April 2020, we hosted a 6-member Middle States visiting team virtually. It was headed by the team chair, Bruce Gerald, president of the University of Maryland, Baltimore system. He and the visiting team met with students, faculty, working groups, senior leadership, the board of trustees, and anyone else they wanted to meet with during that 4-day visit. And then the Middle States team chair made a preliminary report that was streamed to the New York Medical College community the morning of April 14th before they left. The Middle States Commission voted in June 2021, and the great news is they voted to give New York Medical College full reaffirmation of accreditation for the entire 8-year period. Importantly, there were absolutely no recommendations or prescriptive negative findings, so we have no reporting requirements. This is a big deal. The average reaffirmation of accreditation nearly always involves recommendations that we have to report on. And New York Medical College did not have to do that. Just as a reference, in 2011, when New York Medical College had its last reaffirmation of accreditation with Middle States, there were 7 recommendations, which were still particularly a good outcome. So for those of you who apply for NIH grants like myself, this is no recommendations. It's really like getting a 1 on your first grant submission. In addition to the fact that we did not have any prescriptive negative findings or reporting requirements, Middle States had a number of commendations for us. They commended us on our carefully structured and highly inclusive process to develop, review, revise, and assess our mission, vision, and 5-year strategic plan, and the fact that we included our Middle States findings into the new strategic plan. They complimented us on our college-wide Academy of Educators program that we're just really kicking off, that has the goal of responding to faculty needs based on faculty inventory needs to enhance high-quality teaching in all of the schools. They praised us for our effective pandemic recovery and planning initiatives, particularly as it relates to keeping students and faculty safe. Our support and promotion of awareness of diversity and inclusion issues on campus to facilitate transformation of the campus climate, and the important accomplishment of the formal 12-year renewal agreement between New York Medical College and Westchester Medical Health Network and enhancing the long-term stability of the college. They specifically recognized that New York Medical College's association with the Truro College and University system has been a notable benefit to the overall quality and value of New York Medical College. So accreditation and continuous quality improvement are always a team effort. The level of praise that we received from Middle States is a testament to the progress that we have made since our last reaffirmation of accreditation for Middle States in 2011. While we will, of course, continue to innovate and make improvements, the report we received from Middle States should instill us with confidence that we continue to head in the right direction. I and the college particularly want to thank the entire New York Medical College community for your hard work, participation, and support during this process. Special thanks to the Middle States Steering Committee, the chairs, co-chairs, and members of the self-study working groups. You did a lot of the heavy lifting for the reaccreditation. I want to thank all of the individuals who prepared for and participated in the Middle States site visit. Some of you have been working on it for a while. Others had less than 24 hours notice when we asked you to participate. So thank you for your flexibility. I also specifically want to highlight the student leadership and the students who participated in working groups who met with self-study leaders to discuss their insights and experiences at New York Medical College from a student perspective, and who met with the Middle States team visitors. The Middle States team had high praise for the participation of our students and the cooperation and engagement of the entire New York Medical College community. So congratulations and thank you. We did it.
Hello, my name is Adam Hammerman, and I'm the Vice President and CFO of New York Medical College. I'm here to give a quick update on the 2021-2022 budgets. We are very happy to announce that on June 29th, at the recommendation of the Finance Committee and Facility and Real Estate Committee, the NYMC full Board of Trustees approved the 2021-2022 operating and capital budgets. I will start with an overview of the capital budget. The full amount of the plan for the capital budget is $5.5 million. This includes $5 million of cash spend, a significant portion of which is for the library collections. Additionally, there are numerous other projects in the budget plan. Included in the plan is work that NYMC must legally perform and invest in relation to the Energy Performance Project. Also, $500,000 of lease purchases are planned. Each project was presented to and reviewed by the Facility and Real Estate Committee. The main point that I was sure to share is that this capital budget, as in the case with all budgets, is that it is a plan that may or may not change depending on many factors. For example, the capital plan for this past year changed slightly due to COVID, as well as the transition in leadership in the Facility and Real Estate Department. But rest assured, all that had to get done was done. Now, I will review the operating budget. I want to start by thanking everyone from every corner of the campus. To say it takes a village is an understatement. Every school, every program and department at NYMC, and so many people from the overall Turo system were involved. Not a stone on the NYMC campus went unturned. So, as Dr. Halpern promised, we are happy to announce that the Board of Trustees of New York Medical College approved the budget in the black, otherwise known as a surplus budget. This is the fourth year in a row we have had the financial ship of the college in order and a budget in the black. I will now go through a couple of larger items or year-to-year changes that are incorporated in the budget. First, the School of Medicine. With student debt constantly at the forefront of our decisions, we were able to keep the tuition increase so that it continues to be less than our peer group. Our goal is to decrease the cost of attendance at the School of Medicine relative to comparable schools, and once again, we are on track to do that. Additionally, we were able to increase scholarships by $200,000. Based on the increased number of applications, so too the budgeted application fee number increased. We recognize savings from basic science department consolidations and some retirements, but also had some new hires to comply with the LCME standards. Next, the School for Health Science and Practice. Conscious of the financial pressures upon our students, we minimized tuition changes in the evening MPH, DPT, and speech-language pathology programs. And the biomedical ethics program was moved from the School of Medicine to the School for Health Science and Practice. In the Graduate School of Basic Medical Science, we also sought to minimize tuition increases in the Accelerated BMS program and Clinical Laboratory Science program. In our Central Student Affairs Department, for multiple reasons, we decided to invest in the student academic support staffing as well as health services. And we are happy to report that the new model for student mental health and wellness services has been put in place. In student housing, while maintaining a safe and clean environment for students to reside, rent increases were kept to a minimum. In the Office of Vice President for Research, our comparative medicine department has formed incredible outside relationships, and at the same time has incentivized our staff to utilize the services as well. This, combined with new clinical trials unit, allowed us, at the direction of Dr. Kadish, Dr. Halpern, and Dr. Amar, to increase our bridge and seed funding. Now, on to our central revenue and expenses. Here, we budgeted CARES and HERF monies to come in from the government. These are specifically earmarked to help offset COVID expenses. On the expense side, there were significant numbers we had to absorb. We were lucky to be able to budget savings in our health insurance plan with no changes to the plans. However, our legal fees and general insurance premiums for the NYMC and Turo system have increased. This is unfortunately something we cannot control, but something we must plan for. Additionally, there is increased debt service fees, and we also invested in our diversity and inclusion areas. Over the years, our annual depreciation has increased to around $10 million, and we must budget for that expense just as we budget for any other expense. And finally, I am happy to announce that at the recommendation of Dr. Kadish, Dr. Halpern, the Board of Trustees has approved budgeting, and across the board, non-union 2% COLA or cost of living adjustment effective January 1st, 2022. This was a huge hurdle, which we are grateful to be able to incorporate. However, again, this is part of the plan right now. We are hopeful that all will continue as planned, but again, as of now, this is the plan. In summary, all that I just reviewed, plus every dollar and penny in between, makes up the $120 million operating budget that is New York Medical College. I'll repeat what I said earlier. The budget is a plan, and this is our plan right now. Revenue is budgeted in the same manner that expenses are budgeted. Again, I thank every member of the NYMC team for working so hard on every facet of the budget. And now that the budget has been approved and the year has begun, together, we must make it happen. Thank you.
Good afternoon. I'm Dr. Ronnie Myers from the Toro College of Dental Medicine, and I'm here today to speak to you about TCDM admissions for 2020-21, and specifically in reference to the class of 2025, who just matriculated to our campus last week. Historically, the College of Dental Medicine has been in existence since 2020, and we just admitted our 6th class. We are the 66th dental school in the United States, the first to open in New York State in over 50 years. And currently, there were 8 new dental schools that have opened since 2011, and there are actually 4 that are planning to open within the next 2 to 3 years. The class of 2025 joined us on campus this past July 5th. A little background on the national applicant pool and what has happened over the course of the last several years. And you'll notice by this graph that there are converging lines of the number of applicants applying to dental school and the first year admissions positions. The number of positions available are increasing, and the number of people applying to dental school is slightly decreasing. And obviously these lines, if given enough time, could converge. And so that relates to the number of people who are getting into dental school versus the number of applicants. Less applicants for more spaces. So right now it's about 1.75 applicants per space in the United States. As long ago, there were almost 2.5 students applying for each space in the matriculated arena. The gender change, which has been seen in medicine, is also occurring in dentistry. And as you can see, the lines crossed back in 2017. And right now, there are about 60% of the applicants are female and 40% are male. These are first-year enrollees, and the applicant pool is reflected in the same. The historically underrepresented ethnicity group has also been changing, although not changing fast enough. The Hispanic applicants has increased significantly, but the Black African American standard has essentially been unchanged over the course of the last 30 years. And the Native Hawaiian and the American Indian applicant pool has also remained essentially the same, which is something that has to be addressed. Here at the Toro College of Dental Medicine, we have a very robust applicant pool. And this is speaking on the national landscape. There are over 11,000 applicants. TCDM has had almost 2,500 applicants. 22% of all applicants in the US are applying to TCDM for acceptance. Each applicant on the average is applying to approximately 10 schools. And nationally, the application pool has decreased by 5%, but the TCDM application pool has increased by 16%. So we are very fortunate and very sought after from the applicant pool that is out there now. When we look at the class of 2025, the enrolled students come from 14 different states. We have 4 international students represented by 69 undergraduate colleges. 50%, 56% of the applicant pool comes from, or the matriculated students come from New York, 64% from the tri-state area, and 65% of our matriculated students are actually non-traditional, meaning they took a year or more between undergraduate education and applying and getting into dental school. Many of them have advanced degrees. Many of them have been in the workforce, but they are a great percentage of our matriculated students. And at this point, 50% of our matriculated students are 50% are female. And as one can see in the historically underrepresented minority enrollees, we have improved in our Hispanic. We've essentially fluctuated over the 6 years in our Black African American group, and obviously the Native American and Hawaiian Pacific Islander group is almost zero, which is again based, as you could see, on the national trend as well. Our DAT, our dental admissions testing average is 21.1, which is 14 out of 66 dental schools is where we lie. Our grade point average overall is 3.56, and our percent yield, and that is the number of people who are accepted and come matriculate, is 33%. That's a percent yield for the class of 2025. It has been a challenging year, I think, for all admissions groups across the country. We've learned a lot about virtual interviewing, and in fact, it has its advantages for those that need to travel long distance to get here. And our anticipation is this year that we will have a mixed admissions process for those who live locally who want to come to the campus and those who live a distance and are acceptable to be interviewed on Zoom. I appreciate your attention about our class of 2025. Thank you.
Good afternoon. My name is Karen Murray, and I'm the Associate Dean of Admissions for the School of Medicine here at New York Medical College. Today, I'm going to give you a brief overview of our most current admission cycle. The cycle actually ends at the end of this month, but I can give you some updates as to where we are. This year has been an unprecedented year in many ways. We had our first completely virtual admission cycle. And I would like to just say thank you to my MMI interviewers who had to learn a new platform and do this completely virtual. And I'd also like to say thank you to my admissions committee and Dr. Lefkowitz for their hard work in getting this cycle completed. So we'll start with the fact that we had over 15,000 applications this year. That's a 24% increase over the previous years. We invited about 1,000 applicants for interviews. We interviewed about 812, accepted about 530 to fill our class of 211. This year, our yield was 40%. And this is just a quick glimpse at the M1 class yield over the last few years, starting in 2008 all the way to 2021. And you can see that gradual increase in the slope of the line. Last year, we ended with a yield of 46%. So this year, we're slightly below that at 40%, but again, still way above where we've been in previous years. The Amcas national data, we normally get that data at the end of the cycle. So as I said previously, the cycle ends at the end of the month. And so I don't have the data available for this current cycle, but I'm just showing you the data for the last 3 cycles. And as you can see, it shows in the top half of the table, all of the applicants, and then the bottom half shows all of the matriculants, so all the folks who matriculated into medical school. When we compare the matriculated applicants to our New York Medical College applicants, the last 2 cycles, you can see the numbers are very similar, right about average. For this year, we had an increase in our MCAT score to 514, and unfortunately, I don't have the scores for the national average as yet. The demographics for the last 3 classes are here. We have about 54% New Yorkers, which is higher than the last 2 cycles. We have a slight dip in women at 48%. We've had for many years about 50 to 51% females in the class. Our URM percentage is stable at 20%. Our alumni representation went from 8% to 11%, and our faculty representation stayed steady at 4%. This is the national data for the underrepresented in medicine for last cycle. And again, the top half of the table is the applicants, and the bottom half of the table are the matriculants. For when we compare them to our class, we see that our class last year had a higher, not just MCAT score, but GPA than the national average. And this year, our class is even higher than it was last year. And again, we're waiting for the national average to come in. Here again is a representation showing that, you know, we've stayed steady at 20% for underrepresented in medicine students in our class. So this is the overall fact sheet for the class of 2025. Again, we had 15,294 applicants. We interviewed 812 applicants for a class of 211. 48% of the class are female. The students come from 15 different states. We do have 9 international students, and they all represent 98 different undergraduate colleges. The average age of the class is 24. And again, there's 11% legacy representation. So that's parents, grandparents, or siblings who are part of this class, alumni legacy. And we do have 4% faculty representation. Thank you.
Hello, my name is Dean Marina Holes, and I would like to present the admission statistics for the Graduate School of Basic Medical Sciences for the academic year 2020-2021. In the past admission cycle for the Doctor of Philosophy program, we received 45 applications and admitted 20 students, which is a 44% selectivity rate. Out of those, we enrolled 8, which represents a yield of 40%. Our 6 female and 2 male admitted students have an average GPA of 3.3 and represent several countries, such as the United States, obviously, but also Canada, Croatia, and Iran. 5 students will begin their careers as integrated PhD students, while 2 have entered with advanced standing, and 1 will pursue an MD PhD degree. For the Master of Science program in the past application cycle, we received 171 applications this year, which represents a 2% increase from previous year. 84 students were admitted with 30 enrolling, which represents a 36% overall yield. 6 of these students will begin the dental linker program, and the average GPA among students that are enrolling is 3.2, the DAT score 19, and MCAT of 498. A wide variety of ethnicity are represented, with about 17% Hispanic, 3% American Indian, 37% Asian, 10% Black, and 43% white. There are also very good distribution among female and male applicants who will join GSBMS on August 16. For the accelerated master's program for the last application cycle, we had 124 applicants. We accepted 43, which represents 35% selectivity, and have enrolled 15 to date, but these numbers are still changing because we're still interviewing and accepting applicants. So far, the average GPA is 3.4 and the average MCAT is 509 among enrolled students. The group of students that is coming to us is predominantly from the Northeast, specifically New York, Connecticut, and Pennsylvania, but also we have residents of other states such as Florida and also Canada. There are 8 women and 7 men so far, and a variety of underrepresented minorities are also part of our class. For the Clinical Laboratory Sciences program, 9 applicants applied and 8 enrolled. We also have a wide representation of students from diverse backgrounds, and the majority are coming to us from New York State. We're very excited to welcome all new students, and we're looking forward to their classes beginning very shortly. Thank you very much.
Hi, I'm Ben Johnson, Vice Dean of the School for Health Sciences and Practice. For the upcoming 2021-2022 academic year, the School of Health Sciences and Practice will be returning to nearly normal operating procedures, the exception being that some courses, particularly in public health, will be offered in a hybrid format wherein students will have the option of attending in-person classes on campus or attending remotely via a synchronous Zoom link. For physical therapy, across our 3 classes of students, we will have an enrollment of 136 students. Of that group of 136, 80 are female and 56 are male, and 50+ of that number comes from underrepresented minority groups. In speech language pathology, we will have 95 students in our 2 class groupings. Of the 95 students, 93 are female and 2 are male. We have 30+ students in speech who come from underrepresented minority groups. In our pediatric dysphagia certificate program in SLP, we currently have 19 admitted students and anticipate a few more prior to the beginning of the term. Of those 19, 13 are female. As of today, we have 335 admitted students in our public health programs, including the master's and the doctoral programs. And of that number, 234 are female and 92 are male. 134+ public health students are from underrepresented minority groups. Lastly, our master's program in medical ethics was moved to SHSP last academic year. We are diligently marketing this program as I speak. As of today, we have 13 students enrolled in either the master's or certificate programs in medical ethics. And of those 13 students, 10 are female. So in total, the School of Health Sciences and Practice has 598 students enrolled across our 3 departments. Thank you very much.
Hello, everyone. I'm Robin Hershkowitz, Director of Student Mental Health and Wellness. And I've been asked to speak about providing our students with the mental health services they need. I'd like to begin by sharing some changes that are occurring within the department, both with staffing and mental health services. As you may know, Dr. Stern and Dr. Baird Feldman, who have co-directed Student Mental Health and Wellness since 2012, will be leaving New York Medical College at the end of the month. I'm personally grateful for their leadership during my tenure, and I hope you will join me in wishing them the best. As a result, and in response to consistent student feedback for more mental health services, we have the opportunity to meet greater student needs. To accomplish this, we have formed a partnership with one company offering 2 similar but different services through Teladoc and Health Advocate. These allow us to expand our mental health services, resources, and eliminate previous limitations. I'd like to provide you with more details about each of these. Teladoc's virtual mental health services offer students the opportunity to select a mental health clinician of their choice. Students can choose to see a psychiatrist, psychologist, licensed clinical social worker, or other mental health professionals by appointment, for free, with unlimited sessions, 7 days a week, by phone, video, or mobile app. Students can concurrently see more than one clinician. For example, a student may see a psychiatrist for medication, evaluation, and management, and a licensed clinical social worker for long-term counseling. All visits are confidential. This is easily accessible, and because it is telehealth, it is portable. Students can have their appointment wherever they choose. All Teladoc clinicians are board certified or licensed. Teladoc can prescribe most medications through telehealth. If a student experiences any issues, we will work together to resolve them. We are committed to making sure students' needs are met. Health Advocate offers students after hours telephone support, and help. Help is available 24/7. This is a professional telephone evaluation and an in-the-moment support with trained counselors. You can think of this as short-term or immediate care. Health Advocate can also help with other matters, such as financial and legal problems. They can help locate childcare or elder care, and they can also provide substance abuse counseling and more. Any registered student can access these services. So I'd like to pause to invite any students who are on the call to use this QR code to set up their account. I strongly encourage any students here with us today to sign up and explore what's available to you. What will not change are some of the cornerstones of student mental health and wellness services. We will continue to offer and expand psychoeducational events and workshops. For example, yesterday evening, we had a wonderful virtual event with a returning speaker, Dr. Glover, who is a psychiatrist at Montefiore Medical Center, and she spoke about self-care for BIPOC health professionals and how allies can help. We'll continue our interactive screening program, which we offer in partnership with the American Foundation for Suicide Prevention. This is an online, anonymous questionnaire for depression, stress, anxiety, and other mental health concerns. Students can receive a personalized response from a student mental health and wellness clinician, and then communicate anonymously through an online portal. We will continue our valued collaboration with student-led groups and organizations, faculty, and staff. And of course, we will continue to offer our wellness services, such as meditation and yoga. For students who prefer in-person counseling, we will continue to provide referrals to community providers and other resources. And returning in the fall will be our counseling with Masters of Social Work interns, beginning in September through May. We will continue our Mental Health Minute, and we will continue to update and provide our extensive online resource library through the NYMC website under mental health. And this year we will also offer groups. So if this sounds like a lot, it is. And you can review all of what is available to you on the NYMC website. We are confident that these changes will offer increased support, expanded access to clinicians, a larger selection of mental health providers to choose from, and expanded hours of service. So I invite and encourage you to reach out to me directly with questions, suggestions, or feedback, and I look forward to our continued partnership. Thank you for your time.
Hello, it's good to be back. I'm Dr. Robert Amler talking about what's new with COVID. Will this ever end? Well, you may remember this image on the left from a few talks a while back. This is the Control of Communicable Disease in manual from the American Public Health Association. And this is in the center, a future page with all the information about COVID-19. Some is already filled in, but several key areas we really need to know about now are still blank. We need to know about the variants, about boosters, about herd immunity. What about future testing? And what is going to happen this fall semester? Well, let's talk first about the variants. What do we need to know? Variants are common among viruses. So what is most important to know about SARS-CoV-2 is the disease severity of a variant, the vaccine efficacy, transmissibility, responsiveness to treatment, and whether testing is effective. By these criteria, CDC has ranked these 4 as variants of concern. And you can see them listed here with their WHO label, which is used commonly, alpha, beta, delta, gamma, etc. for the others, and the location where they were first identified, not labeling the virus as the responsibility of that location, but simply so people can understand which variant we're talking about. Why is Delta in bold? Because Delta is rising rapidly here in the United States and around the world. So it's in particular a variant of concern. But what about high consequence? So far, variants of high consequence are not here. A high consequence variant would be one that has significantly reduced effectiveness of our countermeasures, either vaccine or medication, and causing more disease, destruction, and even death. But the CDC says currently there are no variants that rise to the level of high consequence. So that is reassuring for now. Moving on, what about boosters? Well, the need and the timing of boosters have not been established yet. We're considered fully vaccinated, as you know, more than 2 weeks after 2-dose mRNA series or the single dose Janssen J&J vaccine. And so this is going to be something that the CDC and FDA are watching closely. And they even put out a joint statement earlier this month that said specifically they see no need for a booster at this time. The key words are at this time, because clearly there could be a need for a booster later on. Finally, personal immunity can lead to herd immunity. With enough people immune, the virus runs out of susceptibles. We need lasting protective immunity in order to get to that stage. Most of that will be through vaccination. The CDC points out that 99% of current deaths from COVID are in people who've received no vaccine. Prior infection also confers immunity, but vaccination is still the preferred route to immunity. What percent immune in a population is sufficient? Well, that's unfortunately going to depend on contact rates, on density of population, on the transmissibility of the virus, so many of these different factors. But the bottom line is we're not there yet. And so for the fall of 2021 coming up just a few days away is get vaccinated. If you're not vaccinated, get vaccinated. In the meantime, stay calm, watch the trends, and improvise. Thank you.
I want to thank all of our speakers. That was an awful lot of valuable information. We've been at a height of 145 members of the college community tuned into the town hall meeting. We've had one question come in. What is the current thinking about remote or hybrid work this fall? The person who would be best able to answer this question would be Tom Madero of the HR office, who has been working on this question, but he's not with us on the panel today. I will simply say on his behalf that as we move to a 100% vaccinated or approved opt-out or approved non-vaccinated campus, we will be having most of the people return to work in person. There may be some selected individuals who we can talk about a hybrid work program, but policies are in the process of being formulated for the entire Turo system in this regard. Thanks for the question. There was a follow-up question regarding when the policy regarding individuals for possible hybrid work will be expected. Based on the amount of work that's going into this, I think we're probably about 3 or 4 weeks away from something being issued on this regard. As you'll understand, it's a moving target. Some of the schools in the Turo system are having required vaccinations like NYMC. Other programs in different states are having different policies. and adapting to a wide variety of job responsibilities makes it a non-trivial problem to come up with a policy for this, which can be enforced and applied fairly. I think you'll need, however, to give us about 3 or 4 weeks before such a policy can be circulated. Our next question is praising Mr. Hammerman's haberdashery. And I'm sure on his behalf, he says thank you. I suppose a good way to wrap things up, if there's no more questions, was on that positive note of the person who wrote in about how handsome Mr. Hammerman looks. We'll take that as a concluding high note for today's town hall, everyone. Thanks for joining us. And if you had a question that you didn't want to type in on our Q&A box, you know how to email us. Otherwise, everyone, thanks for tuning in and have a good afternoon. Bye-bye.